I'm going to go over some simple tests that show if you have muscular weakness. What we're looking for is to see if your body's contracting with symmetry. You should be contracting your muscles the same on both sides of the body. If you have weak spots in your muscles, then when you run, you don't have full participation of the entire chain of motion. If that happens, the muscles that have to take over for those weaknesses will accumulate extra stress, and this will pile up to the point where your performance degrades and you wind up having an injury. So these things are easy to detect with some simple muscle testing that I'll go over with you today. And then we can go over some simple exercises to show how to correct these problems. We want to differentiate between a muscle that's injured and is causing the problem and a muscle that's just not participating in the chain of action because neurologically you've taken that muscle offline because there's some other problem. And so we'll go over those two distinctions now. Good. So we'll start off with a simple squat test. And to do this, you can do these tests on yourself. You simply stand on one leg and put one leg behind and then squat down. Now we're looking for the knee to come down cleanly and for the person to be able to balance on the knee without wobbling, which she's doing. If we dropped a plumb line from the middle of the kneecap down, it should fall between the first and second toe. Good. Let's switch to the other side. Nice and clean. Good. And now we'll try that with a leg out in front. We'll squat with a leg in front. Good. And you see a small adjustment there, but that's a good clean test. And we'll try that on the other side. Good. And come up. We'd like to note here that she's wearing a shoe that doesn't give much stability. These are shoes that don't offer stability or motion control, and it makes the test much more challenging. If you try this in a full motion control shoe, the test is much easier to do. So we want to take that into account when you're doing your test. If it's done barefoot, there's a much greater challenge for that group of muscles. So there is another test that we can do for stability, and we have the person go into a running posture. So step forward and left hand out. Good. And you want to come up on your tippy toes. And good. And now I'm going to reach over and pull her knee out and test to see if it gives. Put the hand around the hip and stabilize. Push in. And she's very stable. Switch positions. Good. I'll come to the other side. Same test, other side. Grab the hip with a stabilizing hand, push in, and pull out. She's able to hold quite well. A person with weak hip rotators or lower chain that's not firing well will not be able to stabilize, and they'll fall right down. So we'll have trouble holding their balance with those tests. For the next series of tests, we'll have the person lie on their backs.